Hi guys, welcome to my channel. So before we get started, make sure to hit that like button, also subscribe to my channel. Today, we will talk about the top 10 foods to clean your arteries that can prevent a heart attack. Your arteries are the largest of your body's blood vessels, and they play the crucial role of delivering oxygen and nutrients to every organ, tissue, and cell. So to say that keeping these vital channels in tip-top shape is important for your health is a bit of an understatement. But millions of Americans are plagued by unhealthy arteries. They have what's called atherosclerosis, an inflammatory condition where plaques, fatty deposits composed of cholesterol and other substances, build up inside arteries, which interferes with normal blood flow and can lead to heart disease, heart attacks, and stroke. Per some estimates, atherosclerosis is the underlying cause of 50% of all deaths in Westernized society, and it's the major underlying cause of strokes and Alzheimer's disease. The good news: there's plenty you can do from a dietary perspective to curb your risk for atherosclerosis and even reverse the plaque buildup that's already there. What causes plaque buildup in arteries anyway? A common misconception about arterial plaque atherosclerosis is that it's mainly caused by high LDL cholesterol levels. But the thinking in this area is evolving, and Dr. Ford Brewer, MD, MPH, a board-certified preventive and occupational medicine specialist, says it's only a small part of the picture. 1. Fatty fish. Fatty fish, including salmon, sardines, anchovies, and mackerel, are a potent source of omega-3 fats, powerfully anti-inflammatory, unsaturated fats that have protective effects against vascular inflammation and atherosclerosis. Omega-3s can also reduce platelet aggregation, which reduces risk of blood clots, lower triglyceride levels, and increase levels of good HDL cholesterol, which helps counteract the plaque-depositing effects of unhealthy LDL cholesterol. Additionally, research shows that people who eat 2+ servings of fish per week are less likely to develop atherosclerosis in their carotid arteries. 2. Flax seeds. Flax seeds are also a good source of anti-inflammatory plant-based omega-3s, alpha-linolenic acid, along with fiber and antioxidant plant compounds called lignans. Regular flaxseed intake has been associated with decreased blood sugar and insulin levels and improved insulin sensitivity among overweight and obese individuals with prediabetes. And preliminary research on animals suggests that regular flax consumption can help halt the progression of atherosclerotic plaques. Just keep in mind, whole flax seeds aren't fully broken down during digestion, so to reap their full benefit, opt for ground flax seeds and store them in the fridge. 3. Berries. Blackberries, blueberries, raspberries, and strawberries pack a big punch when it comes to arterial health. These deeply hued fruits are chock full of polyphenol compounds such as quercetin and anthocyanins, which exert powerful anti-inflammatory and antioxidant effects. Thanks to these compounds and a nice dose of fiber, berry consumption has been linked to improvements in LDL cholesterol, blood pressure, and even blood sugar control, all of which help keep arteries clear and healthy. Compared to other fruits like grapes, oranges, and apples, which are high in a form of sugar called fructose, berries are a particularly great choice for regular consumption because they're low glycemic, either unlikely to spike blood sugar. 4. Citrus fruits. Citrus is jam-packed with polyphenol compounds called flavonoids. These citrus bioflavonoids have powerful antioxidant properties, meaning they scavenge free radicals that might otherwise cause oxidative stress and drive disease processes. Specifically, citrus bioflavonoids can help prevent LDL cholesterol from turning into an even more damaging inflammatory form of cholesterol known as oxidized LDL, which is strongly associated with atherosclerosis. A study found that eating a grapefruit a day significantly reduced cholesterol and triglyceride levels in people who had just undergone coronary bypass surgery. Lower sugar citrus foods are best. Opt for grapefruit as long as it doesn't interfere with any of your medications, or add a squeeze of lemon or lime to your water for a bioflavonoid boost. 5. Extra virgin olive oil. Higher intake of olive oil is associated with reduced risk of death and cardiovascular events like heart attack and stroke. What sets olive oil apart? It's a rich source of monounsaturated fatty acids, MUFAs, and polyphenol antioxidant compounds. Research has shown that diets rich in MUFAs are associated with increased good HDL cholesterol and reduced bad LDL cholesterol, while extra virgin olive oil's polyphenols help lower inflammation, reduce platelet aggregation, prevent LDL oxidation, and reduce blood pressure. Olive oil also has a beneficial effect on blood sugar. According to one meta-analysis, people consuming the most olive oil had, on average, a 16% reduced risk of developing type 2 diabetes and reductions in hemoglobin A1c, HbA1c, and measure average blood glucose over several months. 6. Avocado. Avocados deliver a one-two punch for cleaning out your arteries. Like olive oil, avocados contain loads of blood sugar stabilizing, cholesterol optimizing MUFAs. But they're also a surprisingly great source of fiber, clocking in at about 6.5 grams per half avocado. A recent study also found that eating one avocado per day is associated with reductions in LDL cholesterol. While some people are wary of eating avocados because they also contain some saturated fat, you don't have to worry about that, says Dr. Brewer. Although saturated fat intake may increase LDL cholesterol, it typically only increases the larger, bouncier LDL particles that are less likely to stick to artery walls and cause damage than small, dense LDL particles. Additionally, most recent research has found no beneficial cardiovascular effects of reducing saturated fat intake. 7. Legumes. If you tend to eat a lot of grain-based side dishes, consider swapping them for legumes, beans, peas, chickpeas, lentils. These pack a hefty dose of fiber, including soluble fiber, which can help prevent atherosclerosis by lowering LDL cholesterol. Even one serving of beans per day has been associated with significantly reduced LDL. Legumes have also been linked to reductions in blood pressure and chronic inflammation, both of which are contributors to atherosclerosis and blood vessel damage. According to the American Diabetes Association, beans are relatively low on the glycemic index, which means they're unlikely to spike blood sugar even though they contain some carbohydrates. However, Dr. Brewer warns that among certain individuals, legumes may elevate blood sugar. He advises many of his patients to eat to the meter, glucose meter, especially with lentils, as these can be particularly problematic for prediabetics. Pairing legumes with a source of fat and slash or protein can curb their blood sugar spiking potential. 8. Tomatoes. Tomatoes, especially cooked tomatoes and tomato sauce, are a great source of lycopene, a powerful plant compound responsible for tomatoes' red color, and which has been associated with increased good HDL cholesterol. In one study, people eating a diet rich in lycopene from tomato products were 17 to 26% less likely to develop heart disease. And in another study, higher blood levels of lycopene were associated with lower risk of stroke. Pro tip: fat increases your body's absorption of lycopene, so add a glug of olive oil to that pasta sauce. 9. Allium vegetables. Higher intake of allium veggies and cruciferous veggies, which we'll cover below, has actually been associated with a reduced risk of death from atherosclerotic vascular disease. Allium veggies like garlic, onions, leeks, chives, scallions, and shallots are all rich in organosulfur compounds, which, according to several studies, may help reduce blood pressure, cholesterol, inflammation, and platelet clumping, all of which are great for keeping arteries free and clear. 10. Cruciferous vegetables. Like allium vegetables, cruciferous vegetables, think broccoli, cauliflower, Brussels sprouts, arugula, cabbage, also contain organosulfur compounds and may reduce your risk of death from atherosclerosis. And further research has found that consuming all vegetables, especially cruciferous vegetables, is associated with thinner, healthier carotid artery walls. Thick artery walls, on the other hand, are a marker of atherosclerosis. Cruciferous veggies also contain blood sugar stabilizing, cholesterol-lowering fiber. What do you think of our video? Let me know in the comment section below. Thanks for watching my video.